What was the vision behind launching this company?
There is a dental anxiety in place in India. Traditionally, doctors were not trained enough, or there were few people who were not even having degrees and were practicing dental care.
Why did you choose to raise funding so quick? The basic day-to-day routine of ensuring that you have good oral hygiene is still not taken very seriously. How is Dezy trying to make an attempt to change this mindset?
They should definitely get it corrected because it has a huge psychological impact. Like say if you are in most of the celebrities you see on screen have dental veneers put on their teeth. That's why their smiles look so perfect.
We never knew this. We always use this term 9 to 5 everywhere. So I just want to understand from you, what do you have to say for employees who say this?
You should be available for more than like 12-13 hours.
Things that you do for your dental health.
For dental health,
A very warm welcome to MH's Startup Show, where we talk about entrepreneurs, their journey, marketing strategies, and much more. Today we have Mr. Jatin with us, the co-founder of Dezy Dental, the second largest dental chain in India, aiming to be number one, of course. 5 years into entrepreneurship, aiming to touch base on 500 plus clinics in India and abroad in coming 2 to 3 financial years. We are present in Bangalore, Hyderabad, Chennai, and UAE. You heard me right. A very warm welcome, Mr. Jatin.
Thank you so much, Anuradha. Thank you for having me here. Happy to share my learnings, and hopefully we will reach to the number one player in the dental care market and provide world-class dental care to all Indians in our cities where we are present in.
Yeah, definitely. I'm very sure we would be doing that in coming future. So you started out with BDS and MDS and you got into dentistry, and a transition from there happened where you wanted to explore entrepreneurship and you went to Stanford. What was the journey like of pursuing MBA there?
So I did my master's in dental care in maxillofacial implantology and prosthodontics, which essentially deals with the replacement of teeth. Then I did fellowship from Columbia University for maxillofacial implantology, and because of which I got exposure of US market things happening there, and that is where I got an idea of starting up. After starting up, I wanted to have some management courses in hand. So I did a long distance course from Stanford. I have not done a campus course. There is a program by Stanford for entrepreneurs. I have done that one to have few things from the managerial learnings as well. But the learnings from the startup on the go was the biggest learning on the managerial side than any other course I have attended.
Yeah, I bet I would truly, side by you when it comes to saying that entrepreneurship is more of a learning that you have while you are on the go. You know, you learn, you pivot, you then expand on your team, you downsize. You know, there's all sorts of things that happen in this as a field. Back when I look maybe a decade back, dentistry was something where we would just find clinics, in different by lanes. From there to something technology driven today, where it's a standalone, not a multi-speciality clinics any further. How do you think has this transition happened, and how do you place your journey in this?
So with the advent of technology, the whole face of dentistry has changed. Earlier there were like treatments which were done manually, like doctors using that trays and then mixing impression materials, putting in the patient's mouth, and patients were gagging. The experience was like very bad for patients, and they used to usually hate dentists, or they had dental anxieties when they were walking in the dental clinics. But now like the dental clinics have a spa kind of experience because of the technology. Like if you walk into Dezy Clinic, the ambience is so soothing. Then the technology makes every treatment painless and anxiety free. Like we use intraoral scanners, which are pen-sized devices used to take the impressions. So it makes treatment very easy, digitalized, and easily shareable. So we have like a very expert dentist and planning team, treatment planning team, and treatment monitoring team. And then when the dentists are operating inside the clinics, all those specialist dentists are also well experienced. But even like 7-8 years experienced dentists would want to have a second opinion. So with the technology now, they can share their data which they have taken inside the clinic with the expert planning team or expert monitoring team and have a second opinions, so that we deliver the best utmost treatment to our consumers inside the clinic with the help of group of doctors who are planning and who are visualizing the treatment plans. So with the technology, now we can sit in one corporate office and see how treatments are going on inside the clinic and have a granular details of how doctors are delivering the treatment, what are the experience of the patients, and how much is the occupancy of the clinic. Like on one dashboard, we can see what is the occupancy percentage, what is the overall NPS of the customer, then what are the improvement areas. So with the technology, all these things are possible, and which makes business much more scalable. And also at the same time, when you are scaling up, the biggest problems are it's very difficult to maintain the quality while scaling up. But with the technology, especially in dental care, because the treatments are delivered with the technology and are digitalized right now, scaling up is possible while maintaining the quality, or while making the treatment quality even better when you are scaling up.
Right. So is it technology that helps you make it easily process oriented, so that all your dentists are on the same caliber, they have a set process, also ensuring that whatever the customer is getting at the other end or as a service is same for everyone as a customer? Is that something that you think technology has been able to solve?
Absolutely, it's a good way to put in. Like with the help of technology, we are able to work with a process-driven approach, because when you have doctors, they are never trained to work with a process-driven approach earlier.
Yeah.
But with technology, they like technology can help them to like follow few processes, because technology is making their work and life easier, and at the same time it's becoming a part of process, because now they don't have to do anything extra. Like
Right,
if you would
right.
ask some doctor to like take manual impression and then do something extra to digitalize it, they would not do that. They would not like working in your place. But now you are making their work easier by giving them intraoral scanners, and at the same time automatically it is digitalized. Automatically it could be seen on the systems. We have built processes in a way that doctor has to do their job, and it is becoming easier for them, and at the same time it's becoming a part of process, and the monitoring and planning can be done over top of that.
Okay, just a question came to my mind now. Do you enjoy being a dentist more, or do you enjoy being an entrepreneur more while you're designing all of this?
Both. I think to be a successful entrepreneur in dental care, you need to be loving dentistry by your heart, and you have to know in and out about dentistry. So like I have spent 9 years in education in dental care. So and I come from a business background, business family background. So from the first year of my graduation itself, I used to think dental care from the business perspective as well, like how things can work on the business side, how I can do few things differently and all. So there have been lot of learnings during my education phase as well on that side. But to answer your question, like I love both. I still do few patients as well.
Yeah, I was about to ask that for my audience, that does Dr. Jatin, or the co-founder Jatin, does he actually perform on his patients to this date, or is it just entrepreneurship at the back handing these doctors?
No, I do, like my 90% of my bandwidth goes into managerial things, but 5-10% of the time I do few patients, especially like I have few celebrity patients like Pooja Batra. She is like a actress of Nayak movie, Hasina Maan Jayegi, her dad and her family members. Then few more actresses I've treated. Then I have been treating one of the major pageant contestants
Oh,
lately.
nice.
So few engagement on that side. Then few family members are like, we want treatment from you only, so I have to
Okay.
treat them
Yeah, and
as well.
yeah,
and I do take courses also. So
Okay.
training and courses keeps me connected to the clinical work and few patients, like I've mentioned. But 90% plus things goes into
Managing part
managerial.
of entrepreneurship, right? So I think that even I'll say at MHs, with our team, anybody who is at leadership position, anybody who is an entrepreneur or closest to that, you cannot be best at it unless you know how to execute it end to end. So until you are on the floor, they say, you will never be able to manage it to the best of your capacity, because then you don't know what you are selling as a product or your service. So you can keep this or minus this. Right before this podcast, I went to a founder, I made my pitch, closed the campaign, and then I came for this podcast thing. So, you have to be at the execution as well. So coming back to my next question, at Dezy, when you started it and you are saying that, today you are the second largest chains in India and the aim is to be the first largest in India and globally, what was the vision behind launching this company?
So the vision was to deliver the best dental care to consumers and like leverage technology in-house as well as the available technology to reduce dental anxiety and improve the overall experience for the consumers. And we were lucky enough to get right partners at right point of time to reach to the scale we are. Uh, like in dental care, it's a healthcare and like it's highly untapped in India. There is a huge potential
Yes.
of dental care to expand in India. People only go to dentist right now when they are in very
Dire
much in
need.
pain, dire need, when they have like a pain swelling, and
Yes.
then they think about dentist.
Yeah.
Otherwise, they hate going to dentist. But on the other hand, like a lot of consumers go to like their routine skincare things and hair care requirements, or even a dermatologist for regular checkups. So there is a dental anxiety in place in India, and that is because traditionally doctors were not trained enough, or there were few people who were not even having degrees and were practicing dental care, and they have given a bad experience to consumers who have got treatment done a few decades back. So we want to change that scenario in India, and we want to give the best experience to Indian consumers so that they can experience world-class dental care at reasonable price, and get to and understand the importance of dental care. The healthy dental like the healthy dental health is also important for longevity. It's not just dental care is related to chewing or swallowing the food, but if you have a good dental health, good oral hygiene, it is directly proportional to your longevity. So we want Indian consumers to prioritize dental care, and for that we are trying to make dental care world class dental care affordable and convenient to consumers.
Right, right. Affordable, as you may know now, and convenient because they are ensuring that they tap into almost every tier 1, tier 2, tier 3 city out there in India. So, like you mentioned about longevity is connected to, oral hygiene. If so to speak, I also, encounter this in and around that a lot of times people's confidence, is related to oral hygiene, and they still tend to overlook it, or they don't realize that in a social setting it is impacting, or the basic day-to-day routine of ensuring that you have good oral hygiene is still not taken very seriously. How is Dezy trying to make an attempt through this venture that you've taken up to change this mindset of people?
Yeah, so poor dental hygiene or teeth, crooked teeth, gap in teeth, all these things have a huge psychological impact for the consumers as well. It's not just about the visibility per se, or about the mastication, but it also have a huge psychological impact, because when you smile, when you talk, teeth are something which are visible the most. So if someone is having some sort of imperfection in their smile, and they are if that is bothering them, they should definitely get it corrected, because it has a huge psychological impact. Like say if you are in meeting, if you are meeting someone and that's continuously going at the back of your mind subconsciously, so you will not be able to peak your performance because something is bothering you, something is making you uncomfortable. So treating that thing with predictable results, like we have built an in-house technology with which any consumer at the convenience of their doorstep or after walking to the Dezy clinic, they can go and get a predictable view of how their smile would look like after taking the treatment. And
Okay,
and
nice.
this is absolutely free for the consumers. Like they can come to platform, put in the photographs and request for the at-home
AI
consultation
generated.
or in-clinic consultation.
Okay.
And then there is a AI generated report which is vetted, which is obviously vetted by the doctor before sending to the consumer. It is being checked by the doctor. It has a predictable view of how their smile would look like if they will go for the treatment which we are recommending.
Okay.
So, like this is one of the aspect of the digitalization, and it makes
Is this one of your USPs?
it is one of the USP. Pre-purchase clarity is one of the USPs because if you go to a standalone clinic or even
You never have that option.
even dental some other dental chain, they would not give you the pre-purchase clarity to the extent that what kind of treatment is going to happen, what kind of material they are going to use. Say if you are going for a dental implant, what company dental implant a dentist is going to use, what would be the cost of it, how the smile would look like if patient is taking that treatment. So that pre-purchase clarity is missing in the market, and this is one of the problems which which we are trying to solve for, and we have been successful to some
And you
extent.
have huge crowd out there who come and do this?
Yeah, we have good number of consumers, like almost for like dental implants and all. Every customer takes that report, go through the process, and then visualize how their treatment is going to look like, how many implants, which company implants, which size implants we are going to use. All that is mentioned in the report PDF, and that is being shared to the patient, and then it is explained by a sales executive or a doctor based on the details of the report. And once the patient is like onboarded with everything, then we go ahead and we do the treatment. So it makes treatment much more predictable and much more easy for the consumer.
Also, I think their trust factor in your company must be increasing because of this. Right?
So when we were new, like when we just started up, there was no legacy, and we were competing with brands which had like 10 years of legacy and all,
Right.
or standalone clinics which had legacy of 50 years,
Yeah, and I
third
think
generation
medical is
doctors.
something where, standalone clinics where you had your last 3 generations going is where people end up going.
Exactly, exactly.
Right. So I think somewhere consumer awareness in today's world is something that every consumer demands. So pre-purchase clarity is any organization, be it in product space, be it in service space, giving you enough clarity, be it in terms of process that they're going to use, the technology that they're going to use, the kind of products, their benefits, their disadvantages, the costing. So as a consumer, before you make a choice of buying that product or service, you are aware of where are your other competitors placed, are you comfortable with this costing, and you have enough knowledge of what you want from the brand out there. This is what even MHS does. We ensure that for our brand, even before we suggest them any campaign, we come with a pitch deck, we come with understanding the brand's analysis with respect to their SKUs, with respect to their processes, trying to understand what is their pain point and ensuring that through our work, be it in branding campaigns, performance marketing campaigns, or content shoot, we are able to pinpoint that and solve that. Right. So coming back to our next question, many people who travel abroad, they prefer to wait and get their dental problems sorted in India. It happens in my family too.
Okay.
Whenever my cousins, whenever my sister-in-law comes to India, she ensures that she gets her eyes checked, she gets her dentist work done here. The dental care is significantly, in terms of costing, way cheaper in India when compared to other countries. What's your say on this?
So overall, healthcare is way expensive in Western countries or abroad because dentists and other doctors in India are less paid in comparison to what it is in Western countries, and the cogs, the material used in the treatments are less expensive here in India. But the difference is in the healthcare in other verticals, so say cardiology or other respiratory medicine or any other vertical. Mostly they in Western countries there is a huge penetration of insurance, so the expenses are not happening out of the pocket for the consumers. But even in Western countries, the penetration of dental insurance is very less. It's either copay or it's like not covered.
Okay.
So that's why it becomes like those expenses, dental care expenses becomes out of pocket for the Western consumers as well, and that's why they want to like come to India and get treatment done. And if you see the stats, like dental care is like just 2% of the overall healthcare in India, but if you will see dental tourism, it's more than 10% of overall healthcare tourism in India. So that's why a lot of people want to come to India and get a dental care treatment done, spend some time with family, visit few places, and then go back to their countries. And the good thing is like the demand and this thing is increasing, which is overall good for the Indian economy as well
Yeah,
as
totally.
Indian dentist fraternity. And with the globalization of technology, Indian dentists are delivering equal, if not good, quality of dental care than the Western countries.
Yeah, I will agree that not just for dentists. I think I will agree that for everybody. I mean, be it for entrepreneurs, be it for doctors, be it for engineers for that matter. I think we are delivering way better than people of other countries. So no more the third world countries anymore.
And
Or,
Indians are most hardworking people, so they are able to cater to a lot more consumers, lot more
yes,
patients.
and there is totally now reverse brain drain. I mean, like, I'm so proud of the fact that, there are so many startup founders today who are in early 30s or, early 20s, and they are on Shark Tank. They're trying to, do things on their own. There are companies who take the route of funding, and then there are also companies who want to be bootstrap all their life and still do wonderfully well. For example, at my hostel, we are 120 plus as corporate team, and we are bootstrapped.
Nice.
And that is one thing that all of us take pride in. At least I definitely take a lot of pride in the fact that it is not easy to maneuver your path as a founder when you are burning from your own pocket, ensuring a corporate team of this big size, and then, pivoting into various revenue models to see, what works the best. So if you ask, I'm sure you'll agree to this, even with, Dezy, that the pivot or, increasing your revenue models, number of revenue models is something that you must be doing, strategizing every second month out there.
Yeah, absolutely. And there have been like a bunch of times where we have brainstormed and like changed or like totally changed what we were doing.
Right.
Closed few geographies, opened few geographies,
Right.
tried out, piloted.
Right.
So all of that has happened for every entrepreneur. It happens for every entrepreneur.
Yes. I think
for
the
sure.
same goes with us also in terms of, be it in terms of lead generation, be it in terms of, the kind of services we cater. Like we started out with just influencer marketing 4.5 years back. And then last year it became a lot of content shoot. And then it became a lot of clinic visit and store visit kind of campaigns. Now today, if I remember maybe 2 to 3 years back when I was doing influencer marketing in my own startup, I never thought that ever a hospital brand would come to me and say, Anuradha, I want to do influencer marketing or I want to do content shoot. Today, the highest billing that I do as head of business development is with a hospital brand in fertility space. So the way I think today we are trying to penetrate into the right TG has taken a complete 180 degree shift, where earlier it was just maybe word of mouth, or it was a lot of BTL activities for those who belong to the corporate sector, or it was radio ads, as simple as that. But if we see today, I think there is a drastic shift where everything is digitalized. Like you were saying that the very core of your business is the fact that you stand on technology, which I think I'm sure is one of the reasons why you've been able to scale up so quick. So I think that is something, very positively shocking to me. So if you can share some insights into, how do you think is your marketing strategies, knowing that you are an entrepreneur of this era, a lot to do with digitalization?
Right. So, like the touch points which we are dependent on right now are digital interface as well as the phygital interface. So consumers right now, in India also, dental care is out of pocket. Like the penetration is, the insurance penetration is not there at all.
Right.
So everyone has to spend it from their pocket. So if someone is spending money from their pocket and not from someone who is backing it, like the insurance companies or any other employer or someone, so they would have double thoughts about the treatment, especially when it is high ticket size.
Right.
And dental care is mostly high ticket size treatment, like say 20,000, 15,000 rupee treatments are common in dentistry. Uh, Full mouth implant treatment is roughly like 3.5, 4 lakh rupee kind of treatments. And that is also like at a very reasonable cost. Few standalone clinics would give that treatment for 15 lakh rupees, 20 lakh rupees kind
Oh
of
my God.
numbers. So, people will go to some platform, people will ask multiple people, or people will try to visit 2, 3 clinics before taking the final
Final
decision for
decision.
before buying out. They would like at least look for 2, 3 providers before making the final decision. So our thesis is now internet is available with everyone after 2016. There has been a democratization of internet in India,
Right.
and everyone is using internet. So mostly people are coming online right now and looking for second opinions if they have visited the nearby dentist, or if they have figured out what they are going through, they would look for a dentist, because
Right.
people don't have family dentists right now. Like most of the families don't have family dentists. They would look for a dentist when they have some problem, some kind of dental issues. They would go online, or they would ask someone, do you know some good dentist, or they will search on Google best dentist near me,
Right.
and they will try to figure out, because dental care is required once in 2 or 3 years on an average.
On average, right,
So,
right. I think it's required more often than that. It's just that for
For
Indian
Indian
audience,
consumers, for
let's
Indian,
keep it to 2 to 3 years.
because for Indians it is curative, it's not cosmetic
Yeah.
and
Otherwise,
preventive.
ideally, I'm sure every 3 to 6 months you would expect them to at least check on their
The
oral hygiene.
recommendation, the WHO recommendation, and the recommendation from the dental boards is to get a teeth cleaning done every 6 months by a
Okay.
professional. So
Okay.
every individual should visit a dental clinic once in 6 months, no matter how good they are maintaining their oral hygiene, and no matter if they are having any dental issue or not having any dental issue. And this is a very common practice in Western
In the
countries.
West, yeah.
They make sure that they are visiting dentists every 6 months. But in India, unfortunately, we have not reached that place
Level,
right now.
yeah, yeah, that
So,
reach.
right now, people are looking for dentist on various platforms, and that's why dentist is one of the categories which is most searched on platforms like Practo, Google. Despite not being a significant part of healthcare, it's just 2% of the overall healthcare, but it is like significantly searched category on platforms. So our thesis is to conquer the digital search market first, and 65 to 70% patients come from a digital interaction first.
Okay.
Then 15-20% are coming from
Walk-ins and
referrals which have been happening through
okay, like word
patients
of
who have
mouth.
word of mouth, patients who have got treatment done from us earlier,
Right.
and our aim is to keep increasing this number. And
Nice.
then there are patients who are coming through corporate channel partnerships. Then walk-ins, we have stores mostly in premium areas, or mostly in high walk-in areas on main roads. So people would see our boards and they would walk
Okay,
in the
BTL
clinic. So
activities.
7-8% patients will come from walk-in, and few from the BTL activities and corporate types.
So, if for our audience out there, if you're trying to understand what is BTL and how we were now trying to uh, segregate the 100% of where the leads are coming from, BTL is below the line activities that people get to see, which is for mass out there. So, it could be billboards, it could be hoardings. While it helps to reach to mass, um, better conversions or better niche way to reach your targeted audience is above the line activities called ATL, and which, as Mr. Jatin mentioned, is SEO optimization, like his people can see from Practo. So 70% are coming from the by digitally seeing the things. So that's where a lot of service industry providers like us come, where be it SEO, be it performance marketing, be it branding activities, to ensure that your lead comes maximum from the right source, from your ads, is what we specialize in. Because out there, when you are looking at the higher number of customers, you are looking at segregation of your customers, you see that 7 on 10, as mentioned, comes from seeing it online, while a few are word of mouth, referrals, and BTL activities. Okay, my next question is, recently, dental care products have become very widespread. It's been very recent that you get to hear about neem, and then salt-based, and then wooden toothbrush, and then electric toothbrush. Is it because people are more concerned about oral health, or is it because it is an untapped market where the startups and companies, even those who don't have a substantial grounding to do with dentistry, have been able to penetrate because of digital marketing and marketing campaigns or their research? For example, if you see you as a doctor, since you specialize in this, you combined it with entrepreneurship. But what is your take that these days, everybody out there is opening something in, for example, dental care space, but they have nothing to do with this. So what could be the reason for it?
So I think it's a combination of both things, why dental care products are booming in the market, and there are a lot of brands coming up with newer dental care products, and not even the regular toothpaste and toothbrush, but there are few more products like water flossers and electric toothbrushes, and all newer products are coming in the market. So like the millennials have aspiration to have a better smile, and they are looking forward to spend more on healthcare and dental care and their aesthetics. That's why I think the spends on these kind of products have increased, and it is being leveraged by both kind of brands, like either dentist led brand or other brands as well. Plus in India, the penetration of dental care products was very less earlier. Like a lot of people 2-3 decades back were not using toothbrush.
Right.
They were using the tone, or they were using fingers for brushing, which can never be effective. Toothbrush is must for cleaning teeth. Like brush has a bristles which can reach in the interdental areas, and it can help you to clean the teeth. And the tone and paste only have some chemicals, some surfactants, which will produce some lather and which will help to cleanse, but it will not be able to remove the things present between the teeth and be effective in the cleaning.
Right.
So it's good that now people are getting that awareness, and most of the people have started using toothbrush along with toothpaste. That's like good for the starter. And then there are other dental care products like water flossers, which is a good alternative for flossing. In Western countries, everyone flosses 2 times in a day. So there are threads which are available for flossing, but it is a tedious process. So, and Indians are always in rush. So, so water flosser is a good alternative.
Right. So you see that as an entrepreneur, these are places where you will see a lot of startups come up?
Already there are good number of brands in the space. And like you said, there are few people who are, few brands who don't have background in dental care, and they are just monetizing dental care. So in those cases, especially for the services business like ours, if you are running a brand and you don't know the nuances, if you don't know the details, how clinic functions, doctors don't take you seriously, because then if you are saying something, most of the time it will be irrelevant, because you have never been on that spot.
Right.
If you are saying something and
you're not having expertise
experience, you have not done that thing by yourself, people will not take you seriously, because most of the time it is impractical.
Right.
So like it obviously gives an edge to you if you have experience of that specialty, and you know everything in and out about that vertical while you are starting up. But depends like how brands will
So are you, is Dezy planning to have these products as its SKU in a D2C market ever?
So, like we have plans of doing that. In fact, when we launched our company, we were working in a partner model where we were using existing clinic infrastructure. But then we realized that in dental care, if you want to give a good experience, customer is God, and we have to give a best experience possible. And that is only doable if we own the clinic, if we have dentists on our payrolls, and if we can train those dentists, if those dentists who are delivering the treatment are open to hear and open for feedbacks, which is not possible with the partner dentist. So we have pivoted from that. But at that time, we have dental care products. We had launched, we piloted with dental care products. And
So down the line, you will expand into
yeah,
it.
yeah. But like after some time, we thought the services business is something which is our core thesis, and let's focus on that. So we have kept dental care products on back burner. But we had a dental kit which had a morning and night toothpaste, and it was an innovative approach. I think we were the first one to launch a different toothpaste for morning and
Okay.
different toothpaste for night. And the ingredients were based on that. Like the morning one was more refreshing, and the night one was like more
More
soothing.
soothing.
So
Right. Got it.
it was something which we launched, and it had a decent response. But then we focused on the services business, and
I think maybe you know the core of your business, and it's always good to stick to the core of your business than to try multiple things. Just a question came in my mind. It's away from these questions. In a course of about 5 years, you've raised 4 rounds of funding. There are 2 ways that startups grow. One could be a very native organic approach, which is bootstrap, where the growth is slower, but then you establish yourself over a long period of time and you become a trust or loyalty for at least the hyper-local audience. The other way is when you want to penetrate into a larger audience, touch base on a lot of geographies, you try to raise fundings quicker so that you are able to grow much more faster than these organic bootstrap companies. So why did you choose to raise funding so quick?
So we started with the approach of like making it a organic business, and healthcare is a business which is meant to grow steadily. Not like you cannot see hyperbolic growth in healthcare businesses. So we started with the approach that we will do something meaningful, impactful in the industry, and we always wanted to leverage technology and scale it to multiple cities, so that we are able to reach out to more people in less period of time.
Less period of time.
So that was one reason we wanted to have a few partners who can contribute strategically as well as infuse capital, so that we can reach our destination sooner than bootstrap approach.
Right.
So we were lucky enough to find like good partners in our journey who were understanding that healthcare business will not suddenly like go to like 10x, 20x or 100x kind of approach. There would be a journey of 0 to 1, and that has to be a patient. And then once we have reached PMF, then 1 to 10 or 10 to 100 journey will happen. So we got partners who were credible, like few marquee investors like Sequoia Capital, now known as Peak XV, who are early backer of our company, then Chirate Ventures, then Alpha Wave Investment, Falcon Edge, which is a New York-based hedge fund. So we got a marquee investors like that, and they came in from an approach that we are coming in understanding the healthcare, and they have helped a lot apart from the capital as well, like in terms of connections and helping us to grow. So it has been a
wonderful journey,
good journey in terms of partnering with them. And if we would have not raised capital, we would have grown much slower and have reached much lesser consumers, and have impacted much lesser consumers so far.
Yes.
So that's I think
for my audience out there, what is PMF? PMF is product market fit. It takes a while for any company out there to understand what is the problem statement they're trying to solve, and if the product is meeting the expectations of consumers, which takes good 100 to 1,000 consumers, maybe depending product to product, to understand if that is what the consumers want. If not, then you make tweaks to ensure that you make the right product for the right audience out there. At MHS, we work with a lot of companies who are still at GTM, go-to-market strategy stage, or still at product market fit stage, and we help them understand how to reach the right audience. Also, Mr. Jatin mentioned about raising funds too quick to ensure that he reaches to the maximum geographies or consumers out there at a quicker pace. When we plan branding campaigns, I know of my brands where I do 1,200 to 1,500 influences for them a month. Because the whole idea is that the brand must be known to every Indian out there. It must be a household brand. Everybody must be aware of it, and it's only possible to reach till that level if you are able to penetrate through the local influencers out there. So coming back to another question, Dezy aims to open 300 clinics with a total revenue of 300 crores. Okay, MHS is also coming very close to that because we have so far worked with more than 400 brands by financial year 2025. How is the journey so far? If you ever need performance marketing with best converting UGC ads, which is to touch base on the festivities, which is to touch base on events that are happening, at your office, you know whom to call. Okay, let's minus that. Come back to the question. You had a vision to be able to reach these numbers, these metrics by a certain timeline, which I'm sure, you and your team have figured out. How's the journey progressing so far?
So the journey has multiple pivots, like every journey as we were earlier discussing. So earlier we started with a partnership model, and then we figured out that we have to have dentists who are trainable and who are working exclusively with us. So we started utilizing partner dentist infrastructure and sending our dentists who are on our payroll, who have got all kind of trainings from us and who are getting regular trainings from the central team, going to those clinics and delivering high ticket size treatments like implants, aligners, and so on and so forth. And similarly, at that point of time, we were not owning the asset, but we were utilizing the underutilized asset of existing dentists, because most of the dental clinic have their assets utilized for 30-40% of the time, and rest of the time they are free.
Yeah, ideal.
And they have multiple chairs, like most of the good clinics will have 7-8 chairs, 3-4 chairs like that. So we would use their existing unutilized.
But you're no more in that model.
Yeah, we don't do that thing. So at that point of time, at some point of time, we were having 175 partner centers, and
Wow.
then doctors were going to those clinics and delivering the treatment who were on our payroll. So this was like the interface. The transition happening from totally partner dependent approach to totally owned approach. This was like the middle ground for it.
Right.
Then later on we figured out that we are paying to our partner dentist so much that we can bear the rentals of that area, and we can own the infrastructure, and in that way the experience will get even better.
Right.
Because the look and feel of the clinic would be better.
You'll have control over that.
Control referrals will increase, because now people will see only one brand and they will see this is completely owned by Dezy.
Yes.
So the patients' trust, consumers' trust will further increase. So we went with opening centers. In Bangalore, we opened the first center in Indranagar, and now we have 10 centers here in Bangalore, and similarly for other 6 cities as well, we have clinics in different locations. So in that approach, it's a company-owned, company-operated clinics, COCO clinics, where the whole infrastructure is leased out by us, and doctor and receptionist, assistant, everyone is on the company's payroll. And every treatment is being monitored, delivered, and owned by Dezy. And not just that, we now own the backend as well. We own the manufacturing of aligners, and we have a world-class manufacturing unit here in Bangalore, which is having all major credentials and certifications for manufacturing.
So it is end-to-end by you,
Yes,
so there is no scope of ever a loophole to happen. I'm sure this would have helped you raise the investments.
Yes. So we aspire from Lenscard, and Lenscard founders Piyush Amit is a good friend of mine. So
Oh,
they
is it?
yeah. So they are investors in company as well, and we aspire from them in terms of like owning all three aspects, like the manufacturing infrastructure, delivery infrastructure, and acquisition infrastructure. So all these three infrastructures are now owned by us. So this is like a product market fit for us, and now we continue to expand the signature clinic network, company owned centers network, starting with like certain cities, going deep into the cities we are already in. And once we acquired acquired a substantial market share of cities we are existing in, we are present in all neighborhood of the existing 7 cities we are in. We would look forward to expand into other cities as well, but that's the plan, right?
So, in terms of mapping your various cities, just a question again came to my mind. Which city is performing the best in terms of higher number of customers?
So right now Bangalore, because we have more number of centers in Bangalore,
Okay.
that is
Also, can I say Bangalore audience is more open to trying anything that's lifestyle?
absolutely. I think all tech-led startups or uh, all companies which are coming up with the innovative approach get a good response in
In
Bangalore
Bangalore, yeah.
to
So
start
the
with.
other day, I remember speaking to one of these entrepreneurs. They have, suitcases which, with technology in it for security purposes. Again, they have this first mover advantage. So they mentioned that, though we are based out of North Delhi, all the sales, most of the sales happen from South, specifically from Bangalore, followed by Hyderabad, Chennai. I mean, I think people are very open to, investing here as well as trying different startups as consumers.
And people are tech savvy here, so people would like go to Google for everything.
Yes.
so
Totally.
but like if you have opened up something, you can acquire customers for once from online channels. But if you are not delivering good quality treatment or good
So
quality
it can
service,
backfire.
so it will not be sustainable. So
So down the line, when you open these 300 clinics that you mentioned, where do you want to penetrate more as Dezy? Do you want to penetrate more into the metro cities, or do you want to penetrate more towards tier 2?
So metros, obviously, and right now we are in metros only. Like in
Yes.
7 cities we exist. All are metros except Indore, because Indore was our hometown we started from.
Right.
So rest all is metros, and the reason why metros, because in metros people are open, and people want to explore digital platforms
Right.
for exploring good quality treatments and things which are coming to the market. So discovery is like
It's
digital
easier.
discovery is easier in
Yeah, and also I
metros.
think for you as a brand to be able to, for them to be able to discover your brand, it becomes easier.
Yeah, this is the generic thing for most of the brands. And for dental care, why metros work is because in metros people are spending on not just curative needs but on the cosmetic needs as well.
Needs as well.
And otherwise in tier 2, if you will go, they will just go for a root canal treatment
Right.
if the pain is there, or they would rather go for extractions just to like forget about the pain. And like they are fine. Many people in villages tier 2, tier 3 are fine with not having teeth,
Yeah.
unlike metros.
Right,
So
right.
in metros, people consider like oral health to be a significant contributor to their
Right.
overall health, and they invest in their needs. And the, like I said, our thesis is to deliver a world-class dental care and leverage technology to deliver world-class dental care. So that's more feasible in metros to start with. So our plan is to expand to the metros and tier 1s
Tier
for
1
now.
cities more than tier 2. I think also purchasing power of people here is way better. They're more educated. They're more tech friendly. So all of this adds up to this. I remember when, I would travel as a child or teenager to my hometown. Back then, we never had the model of toothpaste and toothbrushes. My grandfather would go every weekend, and these neem brushes, a bundle of it was bought. So though we would carry, of course, we would carry the toothbrushes. We were used to doing that in cities. Everyone would try that. that generation still sticks to the same, or maybe a few because of penetration of knowledge from their second, third generation children and grandchildren have been able to cope up with this change. Same, I think, goes even for toilets in villages.
Yeah.
You know, they were never used to, or commodes as a toilet versus Indian toilet, etc. So what's your take on this, that, and then what happened, there is another wave now that we are going back to again having a wooden toothbrush, having every second brand in this space talks about neem,
Bamboo toothbrush.
bamboo and neem. So how do you see this change, and why the reverse is happening?
See, it's not the reversal happening. Like earlier, like you said, they were the tune, which was like a neem or a bamboo, where people were chewing it, and then they were expecting that their teeth will get clean. So it might be having some antiseptic effect in the inside the mouth, and like cleansing few bacterias, but it was not cleaning teeth. What, like I said, like for teeth to get clean, there are like convexities, concavities between the teeth. So you need to have a toothbrush at least to like clean it. Like even if you are not using toothpaste, toothbrush is must. Like toothbrush is the thing which will remove the food particles from that, if not bacterias. At least it will clean the food particles, and then when you gargle it, it's clean. So people are now getting the awareness, and they have started using toothbrush. But now a lot of companies are moving towards plastic free and like pro nature kind of culture. That's why sustainability, exactly. So people are coming up with toothbrushes which have a handle of bamboo.
Okay.
But they have bristles in place. They are not saying that you have to chew bamboo.
Yeah, so it's a combination of technology and nature.
Yeah, it's a combination of the toothbrush which we have right now, and the plastic free, eco-friendly bamboo handles. So that doesn't have any disadvantage. The only thing is like bamboo sometimes get like algae or something.
I was about to come to that, because I remember one of my students gifting me that, and I could barely use it for 15-20 days, and water is of course going to be there in the washroom, and it ended up getting algae, and I'm like, how is this then more sustainable?
Yes. So everyone should use a toothbrush, and the bristles of toothbrush can depend on the kind of care is required. Like if you have sensitive teeth, you should use extra soft toothbrush, and if you have more cleansing required, then you should use slightly harder bristles of the brush. And paste selection should also happen on the on the cleansing which is required. Like mostly paste is like fine, but in few paste there are the filler particles are too thick. Like there was one Indian brand which launched toothpaste, and a lot of people started using it, and then many people saw their teeth getting worn out too quickly, and there was a lot of sensitivity issues after that. So any regular brand can be used for as a toothpaste, and the movement of the toothbrush should be like upside down, not just like a horizontal movement, because teeth are usually in this junction. So if you are using brush upside down, the cleansing happens in a right way. So using a medium soft to extra soft toothbrush, and using a generic paste based on the flavor, a pea-sized toothpaste on the brush, and then doing the right vertical movements would give you a adequate cleansing for your teeth.
So I think audience must abide by this and add to the way they brush their teeth. Couple of marketing questions. How is Dezy's acquiring its customers? What are your marketing spends? Where are you investing?
Yes. So we acquire customers, 70% of the customers digitally, mainly through performance channels.
Okay.
Meta, Google. Then there are different categories. Like one of the category is aligners and cosmetic dentistry, which is totally related to the looks and appearance of the teeth. So it includes orthodontic treatment like braces, ceramic braces, then aligners, then veneers, which is like covering over the teeth to make your teeth look much better. And a lot of celebrities, in fact, most of the celebrities you see on screen have dental veneers put in on their teeth. That's why their smiles look so perfect.
Okay.
So
we never knew this.
So there are a bunch of cosmetic treatments, and for this TG, we usually prefer platforms like Instagram, which is
Okay.
which has youngsters or millennials or people under 40 years of age who are more
More
concerned.
open to trying anything that is
And more
cosmetic.
concerned about their aesthetics. Like after 40 years, people are less aesthetic about their
Yeah.
looks.
Yes.
They are mostly related to
Yeah.
the curative part
Yeah.
of
So I
it.
met this hair Wix brand, and this is what even they said, that, the millennials are our aspiring audience who want that as a change, They would rather use a part of their money for this rather than invest on real estate versus anybody in 40s. So you know where to tap in terms of age group, in terms of, the kind of audience you need.
Right, right. So the other category for us is dental implants, which is missing teeth. And for that, missing teeth are mostly commonly seen in like people after 40 years of age.
Okay.
So for those, like we would run more ads on Facebook rather than Instagram or YouTube, because the target audience will come on these platforms.
So
Like
Facebook is not dead.
Facebook is not that. Like in fact, like our the earlier generation is mostly on Facebook. They are
Yeah,
not on
so when
Instagram.
we discuss as at amateurs, since we are into influencer marketing, and most of the campaigns only happen on Instagram and YouTube, when brands sometimes come to us on Facebook and we are like, still the oldies, good morning and good evening and wishing happy birthdays happen on Facebook. So maybe you know where your
Yes.
right TG is lying.
Right, right.
Lovely.
So for this category, the target group is mainly on Facebook and YouTube. YouTube is like having everyone, like the youngsters as well as the old age people.
Yes, yes. I think YouTube is wide. You have all the age group audience out there. And especially for information purpose, people go there more than
Right.
Instagram. Instagram is more of like lifestyle, more of aesthetic oriented.
Right, right. And then for general checkups and all, we usually run campaigns which are geographically led, Google Maps kind of campaigns and
Okay.
all. So like there are different categories for which we have different campaign design
Uh-huh.
and different kind of brand positioning placed for those categories.
Lovely.
And in that way, we design our campaigns.
Lovely, lovely. I think a lot of brainstorming has gone behind this. A lot of trials and errors would have happened.
Absolutely.
Yeah. Okay, so coming to a few personal questions now that we have touch based a lot on, Dezy's marketing strategies. How has it, gotten into so many geographies? What's the vision behind? How have they conquered into the dental space where, in India so far, for almost a decade or more than that, nobody was able to conquer this so far. And they have been able to do this with technology in place, with a process in place, with ensuring that they handle it end to end, having their own manufacturing unit rather than being dependent on partners where the service was, somewhere getting mitigated, its quality was getting mitigated. What are your daily routines, things that you do for your dental health, oral health?
Okay. So for dental health, I brush twice in a day, once in the morning, once in the night. Along with that, I use water flosser because earlier I used to use a thread flossing, but it's a time-consuming thing and it's slightly sometimes it hurts also. So it's better to use it's equally effective in terms of efficacy, the thread flossing and the water flossing. But I personally do water flossing at least once in a day before sleeping.
Okay.
I try for like twice in a day, like in the morning and at the night. But usually I do at least once in a day, and that's it for my dental hygiene. But for overall health, I do a couple of things like working out in gym, and then I like doing trekking and hiking. So
Oh, nice.
I usually go for treks and
So
hikes.
do entrepreneurs have weekends?
Yes, if you have good team in place, then definitely.
So if you are good at delegation.
Yes. But sometimes you don't have, you have to work on weekends. Obviously, that's the
do
part and
do
parcel of.
entrepreneurs have anxiety and sleepless nights?
Sometimes I like, obviously it's more for entrepreneurs because the work and
End of the month?
end of the month, not just end of the month, but like there are times when there is a certain pressure on things, or when like everything ends on you. So if there is something coming up and which is creating anxiety, you have to take that. You have to bear it.
Right.
So there are instances and phases where it's more hectic and you end up taking anxiety. But usually, if you practice mindfulness, like I do meditation often, so
Every day?
not every day, I try to do that. I aim for it, but I am not able to do it on a daily basis. But I try to do it very often. And there are various techniques of meditation I usually follow. Art of Living
Oh,
meditation techniques,
nice.
Sudarshan Kriya, and
Oh,
I have done their
lovely.
advanced courses as well, and I keep doing their courses. And
So, for the audience out there, if you're aiming to be an entrepreneur, if you want to have your own startup, you must have your mental health, your physical health in place, and your oral health in place. What's your take on employees being doing 9 to 5? We always use this term 9 to 5 everywhere. So, I just want to understand from you, what do you have to say for employees who say this?
so, see, if someone is looking forward to work in startup, they should be flexible, in my opinion. But there can be like few gems who are sticking to the approach of 9 to 5. It's absolutely fine. Like if you're doing your work well, and you have you want to prioritize your personal life as well as work, and you are able to finish off work in that duration, it's absolutely fine to do it. But in my opinion, like if especially if you're working for startups, you should be flexible with timing. And there can be like
Need for more than that?
need for more than that. In some cases, in some time you will get compensated with like a few days of like totally free time, and you can take vacation and all. But like when there is a need, you should be available
Available.
for more than like 12-13 hours, whatever it is,
Yes,
as per the
totally.
requirement.
I think that is one of the reasons why people have otherwise also been able to grow faster than, like, today you can't say for this age this is my C2C.
Right.
Today it can be totally
Absolutely.
reversed just because you have been able to do what others couldn't in a faster span of time, or vice versa.
Absolutely. Thus, people having seen pedigree and age difference of 10 years and 12 years, people with like 10 years younger are having more CTCs because they have grown so well in some organizations, and that
Right.
those organizations have rewarded them in certain way.
Right.
So you will see a lot of youngsters
Yeah.
who have
And this
made
is
like
specifically with startups.
millions
as
of dollars
such.
in ESOPs and
Yes. Oh,
their
yes.
compensation.
Totally. So I think that is what we have for our audience today. Follow us and pass the word around. Do comment what's your take on some of the terms that we used. What do you do for your mental health, for your physical health? Check out Dezy's Instagram. Check out them on website. Do check out from where they use the AI to know, what will the pre-care and your look post using their service would look like. They are in multiple locations. So if you're in any of these metro cities, Bangalore, Hyderabad, Chennai, etc., do visit them. And as you invest in mutual funds, as you invest in real estate, as you invest in jewelry, as your planners, invest on your dental health, because it is something in the long run much needed for your health, much needed for your confidence, much needed for you to have a better smile, just like Dr. Jatin. Thank you, everyone.
Thank you so much, Ananda.